Hi friends, welcome back to my channel. Today we are going to discuss how to perform a peak expiratory flow rate skill in NMC Osce. So let's read the marking criteria and I will explain in detail. So first what we have to do the hand hygiene with gel, then we have to assess the area for safety. We can tell I am checking the area for safety and it's safe to approach. Then we have to introduce ourselves. Hello, my name is. Then the purpose of the visit we have to explain. I'm here to explain to you how to perform a peak flow. Is that okay? We should get the consent from them. Then we should explain what is peak flow. So we can peak flow measures your peak expiratory flow, which is the highest flow of your air achieved on forced expiration, which will assist us and you to monitor your respiratory condition and the effectiveness of your medication. So they will get some idea what is peak expiratory flow measurement. Then we have to ask them, are you in comfortable position to do this procedure? Do you need any assistance to? Do I help you to sit in upright, make you sit in upright position like that? We can ask them. Then we should inform them first of all, I need to calculate your expected peak flow. For that one, in the question there will be the age of the patient, so we should ask them. We can confirm again the age and height from the document, and we can calculate the expected peak expiratory flow rate. In the chart there will be a chart available, so you can verbalize this is the your expected peak flow. Then we can ask the patient, and if they need any assistance we can make them to sit in an upright position. Then we can assemble all the equipment there. That is only the peak flow meter. Then we should explain about the machine, that is the peak flow meter. This is the meter. You must hold it horizontally. How to perform that verbalization should be accurate. This is the meter. You must hold it horizontally and keep your fingers away from the gauge when you blow into it. Then we have to show them this is the mouthpiece. It is disposable and this is how it attached to the meter. Then to use the meter you must either be sat or stood upright. Then don't flex your neck and make sure you use the same position every time you perform the peak flow. Then what else we have to tell? You should perform your peak flow 3 times a day. First thing in the morning, lunchtime and before bed. You should have 3 attempts each time and document the highest reading. Ensure the gauge is returned to 0 prior to each attempt. Then we can ask them to take a deep breath through the mouth and seal your lips tightly around the mouthpiece and blow as hard and as fast as you can in a short sharp huff. Then in between we have to ask them, is it clear for them? Do they have any questions? Then take note of the reading and return the gauge to 0. Then ask the person to take rest and repeat the procedure twice more, because 3 attempts they have to do. Then each time you should return the gauge to 0 prior to each attempt. Then the assessor will move the gauge for each reading and document this. Then you have to document the highest record of the readings. Then we can just verbalize, we will dispose the mouthpiece in the waste bin. If it's reusable, we can instruct them to wash it with soap and water and air dry, and they can use it. This is the way we are doing this skill. One more thing we can do, we should instruct them, if there is more than 20% difference between the highest reading and the predicted peak flow, that is the expected peak flow we measured before, then this is a sign that your respiratory condition is worsening and you should follow your asthma action plan or seek advice from your GP. Or if it is an emergency, dial 999. So we should instruct the patient like that. But we don't want to do the difference, check the difference between this expected and we just verbalize to the patient these are the situation what you have to do. And again we can do they have any concerns, is it clear for them? So then next do the hand gel, and then we can inform the assessor the procedure is completed, documentation done, and I will ensure that the tray is ready for next use, like that we can tell. So this is the way we are doing this skill. So I think it's clear for you. So just this is an 8-minute station. So thank you very much for watching my channel. Thank you.